Hey, Dr. Singhal here, and welcome back to our channel. Today, we're diving deep into the world of gum surgery. We're talking lasers, scalpels, stitches, the whole 9 yards. Now, if you or someone you know is facing gum surgery, you know it can seem like a scary thought. But, trust me, it doesn't have to be. That's why we're here today, to break down 2 common procedures: laser-assisted flap surgery and traditional flap surgery. We'll compare and contrast, talk about the pros and cons, so you can make the most informed decision for your oral health. Let's kick things off with laser-assisted flap surgery. This technique is a less invasive alternative to traditional gum surgery. It uses a highly focused beam of light to treat the affected gum tissue. The laser makes fine incisions, causing less trauma to healthy gums. Less trauma means less pain, less bleeding, and a smoother recovery. The laser also promotes faster healing by stimulating collagen production. It cauterizes as it cuts, reducing blood loss and infection risk. However, it's not suitable for everyone, especially severe cases. Always consult an experienced dental professional for the best outcome. Now let's shift gears and talk about traditional flap surgery. This has been the gold standard for treating gum disease for decades, and it's still incredibly effective, especially for those more advanced cases. So traditional flap surgery involves using a scalpel to create incision in the gums. This allows your dentist to lift the gum tissue back, like opening a little flap, to access the roots of your teeth and the underlying bone. This direct access is crucial for a thorough cleaning. Your dentist can remove all that built-up plaque and tartar, smooth out any rough spots on the roots, and even reshape the bone if necessary. This creates a clean and healthy environment for your gums to reattach. Now, traditional flap surgery is particularly effective for those tougher cases of gum disease, where there's significant bone loss or deep pockets of infection. It allows your dentist to really get in there and address the issue at its core. However, it's important to acknowledge that traditional flap surgery is a more invasive procedure compared to the laser-assisted approach. Because it involves incisions and sutures, there's generally more discomfort and pain involved, both during and after the procedure. And because the gums need time to heal around those sutures, the recovery period for traditional flap surgery is typically longer compared to laser surgery. You can expect some swelling, tenderness, and maybe some dietary restrictions for a week or 2 as your gums heal. Now, while traditional flap surgery is generally safe and effective, like any surgical procedure, it does come with potential risks and complications. These can include things like infection, bleeding, or even nerve damage, although these are relatively rare. Choosing an experienced periodontist, a specialist in gum health, can significantly minimize this risk. They have the expertise and precision to perform the procedure safely and effectively. So, there you have it. Laser-assisted flap surgery and traditional flap surgery. Both powerful tools in the fight against gum disease. The best option? It all depends on your individual needs and the severity of your condition. That's why it's so important to have an open and honest conversation with your dentist. They can assess your specific situation, discuss the pros and cons of each procedure, and help you make the most informed decision for your oral health. Remember, early detection and treatment are key when it comes to gum disease. So don't hesitate to reach out to your dentist if you have any concerns. A healthy smile starts with healthy gums. Thanks for watching. We hope this comparison helps you make an informed decision about your gum health. Don't forget to like, comment, and subscribe for more health tips and information.